have a seat now. I'll be with you. Okay. Alright. Just want to let you know you're alive. The whole world is watching you. Okay? Okay, so sit up. Tell me what happened. Sit up, please. Tell me why did you go to emergency room? What exactly happened so I can figure out what's going on.
Oh, what happened, doctor, is I was at home with my wife cleaning the house, and then I was cleaning, the room, and then my wife told me to pick up, the bags with there's a small book inside. So I went to pick up the bags, and then when I pick up the bags, I feel
Snap?
Yeah, like a snap.
Something pop in your jaw?
In my
in
lower
your back?
My lower back.
Okay.
And then after that, I told my wife, it's better. I think I have to go to bed. I want to rest because the still feeling the pain.
Okay.
So I just went to the room, and then I stayed in the room, and then I took Tylenol for the pain. That was in the morning, and then I keep continuing taking the pain pill every 6 hours. But the happiness, the pain is getting worse. So,
Worse?
Getting worse. So at night, I told my wife, I cannot even handle this pain anymore. Can you take me to emergency?
Which hospital did you go? Eden?
So Eden Hospital. It's in Castro Valley. So I live in Castro Valley. So my wife took me to emergency room, and then and it was really, really hard for me to walk. And then the nurse took me to inside the room. So they explained to them what happened, and then the nurse put me intramuscular injection for the pain, and then they gave me I think a strong pain medication.
Yeah, I saw on your prescription it was hydrocodone.
Hydrocodone.
Yeah.
So after that, I went back home, and then the pain is
it's still there.
Still,
shooting pain down your leg.
Yeah, the pain
Which
now.
one?
Now
This
the pain
one?
is in the right leg, or the whole my right leg, and then then the nurse told me I have to to keep continue like just doing exercise, but a little bit, not too much. But she told me avoid to drive. But the problem, I have to sometimes bring my son to school, but my wife is helping me. But when I drive, it's really hard. The pain is
really bad.
Really bad. So the pain is
Let's take a look, see what's going on with your lower back. Okay, just relax. Okay, so no left side motion. Okay, bend forward, please. Forward at your waist. More. Okay, back. Forward again. Okay, stand up, please. Okay. March in place. Stop. Oh, your pelvis is really out. Turn around this way. Okay, turn your feet. Stay straight. Okay, you can see there's a big difference. The left side is like 2 inches taller. Okay, turn around again towards the window. Just stay straight. March in place. Okay, stop. Okay, let's fix it. Go ahead, lie on your stomach face down, please. Okay. Put your hands down. Okay, take a deep breath in. Out. Okay, breath in. Out. Okay, breath in. Go on your side, please. Face me. So, take everything out of your pockets. Give it to me. Okay. Okay. your head straight. Okay, this leg goes here. Okay. Just relax. Relax your shoulder. Relax your shoulder. Relax your shoulder. Felt that move? Okay. Sit up. It's not over yet.
I know.
Move back. Relax. Stand up for a second. Just put this up. Where's the thing? Does it fall down? No, it's right there. Okay. So go ahead, lie on your side, face me. This way. Keep this leg straight. Okay. Relax. Relax, relax your shoulder, relax your shoulder. Okay. Stand on your feet. Okay, face the window, march in place. Okay, stop. How does it feel right now? Sit down on the bench. Okay, push like you push on the gas. Feels a little bit better?
Yeah, a little better.
Yes?
Yeah.
Okay. Okay. What was the worst position that you did that was hurting you?
After 20 minutes when I'm driving, you know, the pain is the whole right, and then here this side.
All the way around?
Uh-huh.
Okay. Okay, stand up and sit down. How's it feel? A little bit better or the same?
Little better.
Better? Okay. Well, let's go get some massage and then we'll go from there, okay?
Okay.